IVF is a very safe process. I would say there are not any major risks. A woman of age 25 has a risk of 1 in 1250 of having Down syndrome, vis-a-vis a woman of age 40 has a risk of 1 in 100. Repeated surgeries on their ovaries would lead to destruction of the ovarian tissue. I wouldn't say that PCOS is an indication for egg freezing, because these women they have a higher AMH and they have a good ovarian reserve. A low AMH would be a reason why she's infertile. It would be the reason why she is why she's finding it difficult to conceive in the first place.
Hello, my name is Karishma Shah. I'm a clinical nutritionist, and today I'm with Dr. Aditi Tandon. She is an OB-GYNAC, she is an IVF specialist, and she's a laparoscopic surgeon. Today, she's going to be talking to us about a very, very burning topic and a very interesting topic. A lot of girls out there are interested in getting to know more about this because it's the need of the hour, and the growing buzz around it is so important for some expert to come in and explain. So, Dr. Aditi, we're very, very happy to have you on board today. Thank you for taking our time and being a part of this initiative today.
Thank you, Karishma. And very interesting topic that we've chosen today to speak about. And as you rightly said, it is the need of the hour. Essentially, what we're talking about today is egg freezing, right? It's basically fertility preservation.
Yes.
Okay, and since it involves freezing, it's called fertility cryopreservation. Okay. Right? So what you're essentially doing is you're freezing time or you're freezing age. Right? Yes. It's like a fertility insurance that you're giving to yourself so that you can have children at a later date whenever you want to. And the reason why this is important is because, as we know, that women are born with a fixed number of eggs, yes, which is, genetically determined. And as we age, month on month, as we menstruate, these eggs are depleted and the number and the quality keeps deteriorating, right? So that is why fertility preservation is like you said, it is the need of the hour and it needs to be discussed. And it's a very important discussion that we need to have, and we should spread awareness about it.
Absolutely, which is one of the reasons why today's conversation is so important, is because so many girls out there don't know about this. They don't know how this happens, what it is. So we're very happy to have you on board today, that you're going to be elaborating on this topic. You're going to be educating us about this topic. So Dr. Aditi, I would like to ask you the first question. What exactly is egg freezing? What do you mean by embryo freezing?
Right. So eggs are basically gametes. They are the female gametes. Yes. And when eggs and the embryos fertilize, it forms into the embryo. So when we are talking about egg freezing, we are essentially saying that we are freezing the eggs of a woman. Now, how this would be done is by a process where hormonal injections are given to the female. These injections stimulate the ovaries. When we give injections, the ovaries are stimulated and multiple follicles are formed inside the ovary, and one follicle has one egg in it. Normally in every cycle, only one egg is released and one egg releases during ovulation. But in this process, we are trying to have multiple follicles and multiple eggs. So once these follicles and the eggs are mature, we give a final trigger, and these eggs are then retrieved out of the body by a process called the egg pickup, which is done under general anesthesia. It's a short procedure under anesthesia. It's done in the OT, and the eggs which are retrieved, which are checked in the follicular fluid, these eggs are then flash frozen, which is cryopreserved. So these eggs are then frozen, and they can be frozen for they basically they're frozen.
Yes. Okay. Wow, this sounds so
Yeah,
fascinating.
exactly. And
I'm,
and when we talk of embryos, essentially when the egg and the sperm is fertilized, when
yes.
the embryo is formed, the embryo is frozen, and that is called embryo freezing.
Wow. Wow. I'm very sure a lot of people had no idea that something like this can actually happen. This is a very new concept, and I'm just very happy that today, we're talking about this. Doctor, the second question that I have is, who exactly needs a treatment like this? Like, when should one consider going in for a treatment of egg freezing?
Right. So there are many indications that that when women need egg freezing, and the most burning one at the moment is social freezing, right? When a woman, suppose say she is 28 and she is not married, she does not plan on getting married for probably the next 3 to 4 years, but obviously her biological clock of her eggs, the number and quality deteriorating is not going to stop. Um, so this particular lady can decide to choose to freeze her eggs, because she
Yes.
does not plan on having children in the near future. So
Yes.
this is social freezing. Of course, when you say embryos, if she has found a partner or if she's married and she does not wish to have a child in the near future, the embryos can be frozen. So you either freeze the eggs or you freeze the embryos.
Okay. And what is the time? What is the age bracket like? What's a common age bracket which is safe to do the either the egg or the embryo freezing?
Right. So I would say anytime between 25 to 30, the earlier you freeze your eggs, the better the results would be. Because results of achieving a success in IVF is basically, it depends on the number of eggs that you get.
Yes.
And the number will be, the earlier you do it, the better the number would be.
Okay.
And
And
so I mentioned social freezing. That is one.
yes.
Other women that need it are, women that have been diagnosed with, say, cancers, who need to undergo radiotherapy or chemotherapy, and these treatments can injure, or they can basically harm the ovaries, the ovarian tissue. So one needs to preserve the ovarian tissue. So in this case, these women can opt for fertility preservation, where their eggs are frozen. And then
Okay.
they can use these eggs later on to conceive.
And Dr. Aditi, what is the time duration which is usually valid enough to be able to use these eggs after freezing them? How much time can we let go? How much time is actually is decided that we could do this up to this time?
There's no timeline as such. Once the eggs are frozen, they can actually be frozen lifelong. They can, they are only once they're needed, they need to be thawed, like how we thaw, frozen meat. That's how. So there is no such timeline. They can be frozen for, uh, a very long time.
Wow, this is very fascinating. And what is the success rate in your experience? All the women that you have helped out, what is the success rate of the egg freezing and then utilizing these eggs?
Yeah. So success rates, again, it basically, the only way that one can use these eggs is via, obviously retrieving it is via an egg pickup. And the only way it can be used is by doing an IVF, right? So for
Okay.
using these eggs, the eggs are thawed, and then they are fertilized with the sperm, and they
Yes.
are then transferred. So it has to be through a process of IVF, right? So success rates, when you asked me, it basically depends on the number of the eggs that we've got. And the success rates are pretty good, because women who are choosing to freeze their eggs would be doing this at a younger age. And we would obviously have better success rates with uh, younger aged women's eggs vis-a-vis somebody who's undergoing IVF at, say 38, and she has a very poor ovarian reserve.
Yes.
So the success rates are much better than women trying to undergo IVF at a later age, and the success rates in general also are good.
And what are some of the risks involved, or are there any kind of risks involved in this?
IVF is a very safe process. I would say there are not any major risks involved. Minor risks, like when these hormonal injections are given, there may be a slight amount of nausea and bloating and maybe some abdominal pain, but that's about it. Otherwise, IVF as such is quite safe a process. And also in egg freezing, what we are doing is we are not going to be transferring those eggs at those embryos at that moment, right?
Yes, yes.
So we give a different injection for the trigger, which is safer than compared to when we would be doing a fresh transfer. So the risks of a condition called ovarian hyperstimulation is almost negated in oocyte freezing.
Wow. Wow, this is such good information. This is so much to know and so much to learn from a concept like this. And now that it's available along with IVF, I'm just so happy that if girls get to know this and they know that there are more options available for them, and not just something that is, where they feel that there is not too much that they can explore if there is a certain age bracket that they're looking to get pregnant at. So I think this is phenomenal, doctor. Thank you so much for all this lovely information that you have given us today.
I just want to add a few things which I sort of missed.
Yes, sure.
Yeah, so basically, when I was talking about the quality of eggs, what I mean is that as women age, the chances of having a genetically abnormal baby increases.
Yes.
So a woman of 25, like the most commonest genetically abnormal, the commonest genetic abnormality that we know of is Down syndrome, right? Trisomy 21, where the chromosome 21 is 3 in number than 2.
Yes.
So a woman of age 25 has a risk of 1 in 1250 of having Down syndrome, vis-a-vis a woman of age 40 has a risk of 1 in 100.
Wow.
And this is purely because of the quality of the egg, which has aged. So aneuploidies and genetic abnormalities in women with in older women can be mitigated if we use frozen eggs.
Yes. I think genetic malfunctions or abnormalities in kids also is something which is which people don't talk about, and they feel that if we can naturally get pregnant later on in life with a set of poor quality of eggs, probably it's still going to be okay if the process is natural, as compared to something like egg freezing, wherein at least there is a possibility that we could avoid something like all these abnormalities in children, right?
Absolutely, yeah. So if you're anticipating late marriage, or if you're anticipating having children at an older age, then you definitely should do something like this.
Wow. Thank you, Dr. Aditi. Would you like to add something else that yes?
Yeah, so there was another thing that I missed when you asked me indications of egg freezing.
Yes.
Yeah, I mentioned the social freezing. Social freezing was one. Another reason why women need to think of freezing their eggs is if they have, conditions involving their ovary, especially something like endometriosis, is where blood-filled cysts are formed in the ovaries, and this leads to destruction in the ovarian tissue. And
Yes.
and this is when they need to preserve their ovarian tissue. And these endometriotic cysts are known to be very they are known to be recurrent, and they
Yes.
keep recurring even if someone with endometriosis undergoes a surgery and removes these cysts.
Yes.
So it would be advised that these women, especially those who have cysts on both sides, and when you know that it is going to affect your ovarian reserve in turn because of these multiple surgeries, these girls can be advised to freeze their eggs, because the repeated surgeries on their ovaries would lead to destruction of the ovarian tissue, and utilizing the opportunity of using egg freezing for these women would be highly beneficial for them. So any
Yes.
kind of ovarian cysts is
So, Dr. Aditi, you mentioned endometriosis. Is there also the same rules that are applied for girls who have polycystic ovaries? Is
no.
there no?
No, so polycystic ovaries. So basically, there is a test called AMH, which determines the ovarian reserve, right?
Okay.
How many eggs a woman has, and this AMH keeps reducing with age. So in women who have polycystic ovaries, they have more number of eggs and more number of AMH. The
Okay.
value of AMH is higher in
Higher.
these.
Yes. Yes. Wow.
Yeah. So egg freezing as such, there's no, I wouldn't say that PCOS is an indication for egg freezing, because these women they have a higher AMH and they have a good ovarian reserve. So they
Okay.
don't really need that, unless, of course, they want to do it for social reasons.
Wow, that's something that because the girls with PCOS usually get so disappointed with so many things that they hear. So this is
So
one thing
probably
which
they're only pro.
yes, this is probably the only little silver lining that they have now. So
Absolutely.
thank you for
Yeah.
sharing that vital information, doctor. Thank you so much for that.
And also we see a lot of girls these days who come with a low AMH at a very early age. Like,
Okay.
say someone walks in at say 27 and her AMH is 0.5. 0.5 AMH for 27 is very low.
Okay.
So even though she is not seeking fertility treatment at that point in time, she should be advised that your low AMH could lead to a problem and difficulty in her conceiving at a later date. So
Yes.
these women who have a low AMH, or if they have a history of early menopause in the family, then
Yes.
these women should also be advised egg freezing.
So, doctor, the AMH test that you just mentioned right now, is it safe and advisable for any girl of, like, for example, if any woman is looking to get pregnant, she wants to check out her fertility parameters. Is it advisable for any girl to go ahead and do it?
Absolutely. We routinely advise the AMH, which is the anti-Mullerian hormone, when we begin fertility treatment. That's why we have seen that women um, who are young have had low AMH,
Yes.
and it has actually been quite surprising that we've seen so many women with low AMH at an early age. So
Yes.
it's a test that we routinely advise to know the ovarian reserve of the woman.
And if a woman is infertile due to whatever reasons, hormonal issues, fluctuations, whatever, a test like the AMH will be able to give us a better parameter of what her fertility levels are, correct?
Absolutely. So a low AMH would be a reason why she's infertile. It would be the reason why she is being, why is she's finding it difficult to conceive in the first place.
Interesting. And doctor, is this genetic? Is there a genetic
Yes.
parameter to lower AMH?
Yes. Like I mentioned, the ovarian reserve of a woman is purely genetically determined. Unless, of course, like I mentioned, conditions which cause destruction to the ovary, like if a woman has to undergo an ovarian surgery, like removing a cyst from the ovary, this would also cause in reduction of AMH.
Yes.
So per se, the AMH is genetically determined. And if there is any surgical procedure that needs to be performed on the ovary, that can also reduce the AMH.
Oh, okay. That is also very interesting, because I think a lot of girls don't have an idea of, the freedom to check something like this. Maybe, even mothers would never educate their daughters saying that, there could be a possibility like that, and you could probably go in for a test like this. So thank you, doctor. This is something so important that girls these days should be knowing about this.
Absolutely. I think not only for women that come for fertility treatment, I think we should do this test for all women that come, and so that they know and they have an idea about what their ovarian reserve is like.
I also feel, and you will agree, that knowledge is power. And I think when women are very aware about what they have on their hands or what they have in their body, I think it creates so much of a difference within the woman itself. And I think things like these, all the concepts that you beautifully mentioned today, the egg freezing, embryo freezing, the AMH tests, and the IVF concepts that you mentioned today, I think all these things are a very powerful tool for women these days. And if used in the right way, if, processed in the right way, and probably, consulted with experts like you, it could create so much of a difference within the overall mindset of women, the way they approach things, the way that they can plan things more so.
Absolutely. Yeah. It's like taking charge of your fertility.
Yes.
Yes. You're not just leaving it to age and genetics. You're using technology and using it to your advantage.
Yes. And that is really powerful. I think, for all the women out there who are going to be listening to this, for everybody, getting all this information today, I think these things are, because of all the technology we have today, because we have such talented doctors, like yourself, who are here to talk about things, educate people, tell them about these things, do these kinds of procedures. I think it's creating such a different generation of looking at things now, and not just, we have our traditional values, but we also have a new modern set of ideas where it can benefit women in some way.
True, absolutely. Like recently, I had a couple. She was the wife was 35, and the husband was 39, and the wife's AMH was 0.03, which is, of course, at 35 we are expecting a low AMH, but not that low an AMH, right? So I was just mentioning to her that we these days are advising women much beforehand to freeze their eggs, freeze their embryos, so that they do not reach a situation like this particular couple who chances of retrieving eggs in a woman with such a low AMH would be a big challenge for us. So if she was told beforehand to if she was given the option, then she would be in a different position today.
Absolutely. I completely agree with what you just said. Doctor, before we end today's conversation, one final question that I would like to ask you, because you mentioned a case study right now. In your experience of meeting so many young women, women who want to get pregnant, who've come to you with pregnancy also, does lifestyle change, does diet change, does exercise really help with, conditions like, better prenatal health, better fertility rates, better, egg quality? Does it really play a role in it?
Definitely, to an extent, definitely, because obesity has its detrimental effects on, pregnancy. It also has its detrimental effects on ovarian health, and so definitely lifestyle changes and including a good diet with, rich in antioxidant definitely helps in the health of your gametes as well as throughout your pregnancy.
Thank you so much for all this information that you have given us. You've been kind enough to share so much with us today. very, very important information. All the women who are going to be listening to this are going to be educated in a very new and important way now. So I would like to thank you from my behalf, Karishma Shah, for being a part of this conversation and this initiative.
Thank you. Thank you for having me.